All right, so we're going to be palpating 5 muscles: upper traps, middle traps, lower traps, rhomboids, and levator scapula. So, starting off with the upper traps, the origin is going to be at the occipital bone and nuchal ligament of the first cervical vertebrae, of the processes of the first cervical vertebrae, and it's going to insert at the lateral third of the clavicle and acromion process. To show this muscle working, we're going to have our patient bring the shoulders towards his ear, and you can feel it contracting there. So relax, and it's going to be this muscle right here going all the way up. The innervation is going to be cranial nerve 11, which is the spinal accessory, and the action of the upper traps is going to be elevation and scapular upward rotation. So the scapula is going to move that way. Moving on to the middle traps, it's from C7. The origin is from C7 to T5, which is going to be around here, C7 to T5, and it's going to insert on the scapular spine, which is right here. So it's going to go, T5 would be right here in C7, so it's going to insert at the scapular spine. This is the action of this one is to retract. So we're gonna have our patient bring his elbows back, and you can feel it right here, this muscle contracting right here. And this innervation is also cranial nerve 11, which is spinal accessory. Moving on to the lower traps, it's gonna go from the middle thoracic vertebrae to the lower thoracic vertebrae of the spinous processes. And it's going to insert at the base of the scapular spine, And this one is for the action of this muscle is for upward. Actually, to show it, we can have our patient do depression of the scapula, and you can feel it contract right here. So the actions of this one is going to be downward rotation, upward rotation, scapular depression, and the nerve innervation for this one is going to be cranial nerve 11 as well, spinal accessory. Moving on to the rhomboids. Correction, for the middle traps, it's going to go C7 to T3, not T5. It's going to go to T3. So moving on to the rhomboids, that's going to go C7 to T5. And it's going to insert on the vertebral border between the spinal or scapular spine and inferior angle of the scapula. So to show this muscle work, well, it's deeper to the middle traps. So we're going to have to kind of get in there to feel it working. The muscle action for this one is going to be elevation and retraction, as well as downward rotation of the scapula. And this nerve for the rhomboids is going to be the dorsal scapular nerve. And finally, the levator scapula. That one's going to be, the origin is going to be at the first 4 vertebrae of the cervical region on the transverse processes, so it's at the side of the vertebrae. And that one's going to insert at the superior angle of the scapula at the vertebral border of the scapula between the superior angle and the spine. So it's going to be right up here. And this one is responsible for scapular elevation and downward rotation. And the nerve for this muscle is going to be the 3rd and 4th cervical nerves and the dorsal scapular nerve. And this one to feel that one, you're gonna have the patient elevate, and you can feel it kind of working in there. It's a little deeper, but it's working. And that's about it.